Hello, I'm Dr. Lauren Houghton from the Department of Epidemiology at Columbia University's Mailman School of Public Health. This video is part of our Mixed Methods series to serve as an introduction to public health scientists. This session discusses some challenges in mixed methods. Some researchers argue that opposing paradigms justify keeping quantitative and qualitative approaches separate. However, I and others argue that they are complementary, as each method can access different aspects of a research problem that cannot be accessed with one method alone. So, in relation to quantitative methods, they usually lead to generalizable results. However, they do not always capture the full complexity and dimensionality of issues. This is in contrast to qualitative methods, which do have limited generalizability. However, they're able to explore and understand complex phenomena. Mixed methods can bring both of these together to overcome the limitations of both methods. So in relation to generalizability, an example is that mixed methods can help to assess generalizability by including a large and representative sample for quantitative analyses, and it can also collect qualitative data to gauge if the local context reflects the larger one. So by using mixed methods, both the limitations and strengths of quantitative and qualitative methods when it comes to generalizability can be addressed. Even though mixed method overcomes limitations of using quant or qualitative data methodologies only, mixed methods in itself has limitations. Mixed methods study designs may require more time and resources than study only using single methods. Therefore, researchers should ask themselves, is there sufficient time to collect and analyze two different types of data? Are there sufficient resources to collect and analyze both types of data? And are the skills and personnel available to complete this study? In terms of researcher skills, ideally, someone conducting mixed methods should have experience in both conducting qualitative and quantitative data collection and analysis separately before conducting mixed methods. But few disciplines actually span the methodological divide, and so finding individuals equipped in both these skills is actually quite rare. Also, this is not possible for someone coming to mixed methods research to achieve. So, at a minimum, a mixed method researcher should be acquainted with data collection and data analysis and understand the rigor and quality of both methods. Our introduction video is a good start in acquainting oneself with these concepts for both quantitative and qualitative methods. An alternative is to be aware how mixed methods can enhance your current methodology and designing a mixed method study with collaborators. Think rub-a-dub-dub, 3 men in a tub. Instead of the butcher, baker, and the candlestick maker, a mixed method dream team could be 1 quant, 1 qual, and 1 mixed methodologist. Regarding sampling issues, in the previous slide, we discussed generalizability, and mixed methods can help overcome this challenge through strategic sampling. But doing this is not easy. Challenges specific to concurrent designs, such as merging quantitative and qualitative research, include having adequate sample sizes for analyses, using comparable samples, and employing a consistent unit of analysis across the databases. For sequential designs, the issue relates to deciding what results from the first phase to use in the follow-up phase, choosing samples and estimating reasonable sample sizes for both phases, and interpreting the results from both phases. Number 4 is conflicting and contradicting results. So despite carefully planned designs, there often are situations where data cannot be easily integrated or provide opposing conclusions. I have had this experience, but actually find that when qualitative and quantitative results diverge, that this actually can be quite exciting and act as motivation for new hypotheses. So while it may be frustrating within a single study, it oftentimes motivates and moves our research forward for future studies. And this, I argue, is what happens across all research. And lastly, there's a challenge in educating others about what mixed methods really is. People have preconceived notions of mixed methods. Very often, those with a quantitative orientation conflate mixed methods with qualitative work. But the best way to educate others is to provide examples from the literature. Educating your audience is crucial when applying to grants with reviewers who may not be versed in mixed methods. The OBSSR's Best Practices document is very useful when it comes to writing grants and writing up mixed method studies. I would also argue that another way to educate others is to actually make qualitative methods and results and conclusions explicit in our epidemiological and public health papers. Many times people argue that this is just what good epidemiologists or researchers do. They talk to their participants and use that to help interpret. But I ask, why does this have to be hidden? I think by actually systematically reporting on qualitative methods that we use in our more quantitative studies can also help elevate the use of mixed methods.